Okay, so as we've been talking a lot today about, all of these different things, but, we had a significant section on combination therapy and triple therapy. I'm going to start with you, Maria, and ask, have you felt that there's enough data to support that combo or triple therapy improves health outcomes and has the potential to lessen costs?
Oh, I think there are. I mean, there's no question. I mean, pharmacotherapy is having a major impact on not only symptoms, but the reduction in exacerbations. We see this from a lot of the studies when these first drugs even come out, much less than in the real world. I think many have proven themselves to have an impact on exacerbations and ultimately ER visits as well as hospitalizations. So that's part of what we usually want to see at launch, as well as even in the real world, the ability to understand what that impact is on total cost of care.
And what do you think the patient perspective is on the use of combination or triple therapy and how it's affecting them and whether or not it's lessening their, healthcare utilization?
So there's two components. The one is, if it makes them feel better, they love it, they're happy. The other side is if it reduces risk, they may not immediately perceive that. So that's like treating cholesterol or hypertension. That takes some education to get compliance. If you're adding an inhaled corticosteroid to a dual bronchodilator, they may not perceive an immediate benefit from that, but you need to tell them that I believe this is going to reduce your flare-ups. It's going to stabilize your disease. And there has to be an education piece. They have to understand why they've added that, maybe that expense, or they've added the need to use a couple of inhalers at times.
So I have to say this has been a great conversation and really outstanding dialogue. I think that people are going to get a lot out of this. Before we conclude, I'd like to get a final thought, maybe just a couple of sentences of the major point you want to get across, or something like that, or something that you found particularly interesting or newsworthy that came out of our conversation today. So I'll ask you to go first, Maria.
I think tremendous opportunity in COPD to both on the prevention side as well as the treatment optimization. I heard some great comments and feedbacks from thought leaders around how PROs are being instrumental in understanding and assessing what the patient symptoms are, but also how do you individualize goals, and hopefully that creates not only a meaningful impact, but really optimizes care and the care delivery as well as impact on total cost.
Frank?
Yeah. So I think it's important to recognize, that we can do something with this disease. And unfortunately, this disease has been stigmatized as often former smokers. It's been defined as irreversible. But the reality is that many diseases in our society are based on just human errors, human activities, and we should not stigmatize these patients. The data shows we can have impact on how they feel, and we can have impact on the costs of the healthcare system and the burden, and we need to take them seriously, treat them, do evidence-based therapy, and not treat them like we did 30 years ago with just short-acting bronchodilators and steroids, because those are the wrong treatments.
So I'll say one good thing and one upsetting thing. The good thing is this is a preventable and treatable disease. We've got treatments that work now. We need better treatments going forward. The second part of that is, despite its impact, COPD continues to receive a fraction of the research funding provided to all the other major diseases. There's a reason we've made the progress with HIV and cardiovascular disease and cancer. It's billions of dollars in research funding every year, while COPD continues to struggle with a very little amount of funding. You get what you pay for. We can do better. We need to put more money into it.
Okay, well, I want to thank our panelists for a very robust discussion, and I want to thank all of you. And on behalf of our panel, we hope you found this peer exchange to be useful and informative, and we'll see you at the next one.